Hello, and thank you for taking time to view this presentation. Um, and this project was developed for a medical staff agency with the goal of improving and optimizing coverage during upcoming flu season in the United States. Specifically, we focus on identifying high-risk age groups and states across the US in order to help reduce flu deaths and hospitalization during the next flu season years. Which data we use? We use data sources from the CDC and the US Census. The data that was collected was from 2009 to 2017. This is an effort to better plan for the next flu seasons in the coming years and support actionable decision making. In this first chart, what can we see? This chart is very clear. The one in the left is showing us the flu deaths in the last few years. What we can see that we be consistent with the numbers. We had spike in 2013, 2014, and 2015, and in the chart in the right, we can see we have the monthly deaths totals during these years, and it's very clear that the flu seasons start in October, and as the first spike in December, and then the highest spike is in January, and then it starts to goes down until March, where probably we have a second wave of flu coming. In this next chart, it's very interesting to see the age groups that are most affected. And there is no doubt that the people in the 65 plus years old age groups are the most affected with considerably higher deaths. And what we can see from the right is also the correlation with these deaths. We can see that we have divided all this data from regions, and in almost all the regions we can see that more population always bring more flu deaths consistently. What is interesting to note is that for the West region and the Northeast region, higher population really means higher flu deaths. And there is no really something in the middle like the rest, which means that those numbers, they really are repeating on bigger states in these regions. This is a confirmation that this region should be really looked after for the upcoming season. Here we can see clearly the map of the deaths for the total population, which is all these colors in blue. This is the total deaths, and in the circle in the orange we can see the deaths that are in the 65 plus years age group. So it's very easy to notice that we have, for example, California and New York State, also Texas and Florida, to have higher deaths overall and also higher deaths in a 65 years plus population. This chart as well is giving us a very important reading because this shows the highest percentage of 65 plus years old. That's in proportion to the same population, which means in this state, like Alaska, Wyoming, North Dakota, for example, uh, the flu is more lethal in this situation. That could mean there is less coverage or these people are less cared for in this situation. So it's important to note these states as well as very high risk states in order to protect these people. Here we have as well the states that are most affected. We can see a clear top 10 chart where we can see California, New York, and Texas, as we already said before, and Pennsylvania and Florida as to be the highest risk states. And on the right, there is the possibility to choose a state of choice in order to compare these numbers with the higher numbers of these other states. This is our forecasting to be expecting for the next few years. Um, we still have divided by region. We can see almost every region confirm the number with the model that we use to forecast these deaths. And we can see that we're gonna have a slight increase in every region for the upcoming year. Um, it's very clear, for example, that the West is gonna have probably a less spike than a less higher spike than others, while the South still have a very big chance of having an increase in deaths, and the Northeast and Midwest as well. So what all these informations are telling us? Well, um, we understood that, for example, for sure the highest people at risk are the 65 plus years old people, uh, which have higher death than any other age group. Um, so this is very important to be note for when we plan for the next year. Also, we have a list of high risk states, as I already explained before. California, New York, Texas, and Pennsylvania to be very high risk with very high deaths. It's very important to remember that as we seen in the first few charts, that the peak months are always between November to January. So when we're planning, we should consider enough stuff in order to have these months covered. And another very important thing is to decrease the planning of this stuff, considering also the second wave flu in March. What can we do next to in order to um, optimize this planning year after year? Which kind of limitation we had? We couldn't collect any information on flu vaccination rates, for example, and we couldn't collect any data for regarding the hospitalization figures numbers, and also the number of staff that was employed during those years, and particularly during these peak months. So for the future, it will be very helpful to collect this data, to have data about flu vaccination rate for every state, and to have a number of the staff that was employed for every month in every state, and also the hospitalization number during the same period of time. Another very important thing will be to collect some feedback surveys from staff or from patients as well, in order to see if there is any major problem or any major issue that could be addressed and optimized year after year.